Have you ever wondered how mental health care plans are created? It all begins with assessment. In this video, we explore the integration of assessment into clinical formulation and care planning. A comprehensive clinical formulation is essential. It brings together diagnostic impressions, risk profiles, and biopsychosocial factors. This synthesis helps us generate a working hypothesis. It explains the cause and maintenance of an individual's difficulties. Now, let's break down the process step by step. First, we gather information through assessment. This helps identify the individual's unique needs and challenges. Next, we evaluate the data to understand the complexity of each case. Once we have the information, we develop a personalized care plan. This plan sets realistic goals and identifies evidence-based interventions. These interventions can be pharmacological, psychological, or social supports. For example, consider someone dealing with depression and alcohol misuse. Their care plan may include antidepressants if needed. Motivational interviewing and relapse prevention become vital tools, along with psychosocial interventions that address housing and employment. Next, let's talk about first episode psychosis. A rapid assessment is essential here. Early intervention services can be initiated right away. Antipsychotic treatment might be appropriate, along with family psychoeducation and vocational rehabilitation. Now, let's look at adult ADHD. A comprehensive assessment is crucial. The plan may involve stimulant medication while managing misuse risks. Cognitive behavioral techniques and workplace adjustments are also key components. It's important to highlight that care planning must be collaborative. It should respect cultural sensitivities and be regularly reviewed. We also need to measure outcomes and have contingency plans in place for any deterioration. But what about the clinical and ethical considerations? Mental health assessments pose unique ethical challenges. Confidentiality limits must be understood, especially where risk exists. Informed consent is also critical. Family involvement and safeguarding vulnerable individuals remain paramount. Balancing patient autonomy with duty of care is a delicate task for clinicians. Cultural humility and reflective practice help navigate these ethical waters. Ongoing professional development ensures ethical and effective assessments. In conclusion, mastering psychiatric assessment techniques is vital for effective mental health care. Accurate diagnosis needs to be framed within a biopsychosocial context. Valid screening tools enhance case finding and tracking. By translating assessments into person-centered care plans, we can optimize outcomes. So, what steps will you take to improve assessment in your practice? Subscribe for more insights and let's enhance mental health care together.